this area, and its Chief Executive, Dr. John Falzon, joins me from Canberra. Dr. John Falzon, thanks very much for joining us. How big an issue is housing affordability to those who are facing homelessness?
Look, in a prosperous country such as Australia, to have such a severe shortage of social and affordable housing is nothing short of being a scandal. We've got over 200,000 units of social housing as a shortfall, people waiting desperately for somewhere to live. Now, it so happens that it's not only World Homelessness Day, but also World Mental Health Day. And I've got a very simple and positive message, and that is that a home is not just a roof over one's head, as important as that is. It's also a place in which people can feel safe to be themselves. And so it's enormously important, if we want to be a caring, compassionate and fair society, that we need to make sure that no one misses out on an essential of life such as a place to call home.
With these 2 days overlapping, World Homelessness Day today and also Mental Health Day, how do these two issues overlap?
Look, they overlap in very many complex ways. We know, of course, that one of the chief causes of a sense of feeling out of control in one's life is being placed in a situation socially, economically, where one's control is taken away. And so one of the things that really unites all of us, and diversity is a wonderful thing that we should celebrate, but there is something that unites us, and that is we all like to feel a sense of control over our lives. And so the way we achieve that as a society is by making sure that everyone has access to those essentials: a place to live, a place to work, and if you can't work, then income adequacy, a place to learn. Education is so enormously important, and that's why we're very sad to see the current government having walked away from its commitment to, for instance, the Gonski education resource funding reforms. A place to heal is enormously important, and you know, none of those things can happen whilst we live in a society where inequality is ramped up. Interesting research from British academics Richard Wilkinson and Kate Pickett shows that the more unequal societies around the world have around 3 times a higher prevalence of mental illness than more equal societies. So inequality worsens, exacerbates the problem. So the more unequal a society is, the greater the source of social ills. And so our big enemy is inequality, and we need to do everything we can to fight this enemy, and that's going to make us a more compassionate, caring society.
Just very briefly, what more do you think the government should be doing?
Well, for a start, the work has been done. You've got a homelessness white paper that was produced by the previous Labor government that sets a set of targets to reduce homelessness. We'd love to see the current government committing itself to those goals and making sure that national responsibility is taken in the areas of homelessness and housing. The Mental Health Commission has produced a report with a set of very practical recommendations in that area. So those two fronts have been covered as far as the work that needs to be done. We'd love to see government sitting down with the relevant organisations and peaks and making a very public and indeed bipartisan commitment to getting those things done, because you know, we all lose when we have a society that humiliates people. Let me just give you a couple of quick examples. You know, compulsory income management on people who are living in poverty. This takes a sense of control away from people's lives. This isn't good for mental health, and it doesn't actually improve employment prospects. Penalty rates, it's not always about just income, it's about a sense of feeling respected. Penalty rates are a way of trying to compensate people for having to work on Saturdays and Sundays, taking that choice away. So that sense of being all in it together, being trying to achieve a more equal society, that's the kind of Australia that most of us would like to imagine.
All right, Dr. John Falzon from St Vincent de Paul, thanks very much for your time today.
Thank you.